What's going on, y'all? I don't know if I got the Facebook one on. I gotta fix that. So listen. So this is your second part of what we was doing this morning. Okay. The links that are on that chat that's before this, that's how you're gonna get your books from there. I just wanted to come in to make sure that you had those links because you can't do the class, this portion of the class, you need to have your CPT book. Okay. So make sure you guys get the CPT link. Okay. And that link is actually below. It's below. Okay. Um, I'm gonna go ahead and put. I think I can snatch it from here and go ahead and put this. Which one is this? Okay, so this is a CPC book. I'm gonna go ahead and put it here, for your, and this is like your sample version. But the beginning of this book should be good. You should be able to still use this book. Okay, and I sent you guys that step by step one. Okay, we're not in ICD 10, we already passed that, but we're going to come across that again in your training. So here's the book for that. Again, these are like temporary books that I'm sending you. The step by step book, let me find that one. So there's a temporary one for that one as well. So this one is the temporary one for the step by step book. So use this link for that. Even if some of you never did coding before, this is how you get an insight of looking at the coding. If you just want to learn about coding, you don't know anything about coding, you just want to figure out if it's for you or not, then I would do my book. Okay, this is the link for my medical billing and coding book. You can get it from there, or you can order it from me. Okay, you can go to. I'm gonna put my website here, so y'all can go to my website. When you go to my website, you're gonna go to my bookstore, and if you want to join the courses, you can also join the courses there. So, all right, let me get rid of that. So, the links that I just put up there, those links are to help you with your course, especially those of you who do not have your book. So again, this is the second portion from this morning. Okay, so let's see if we can get the max screen up. I did the second portion because we couldn't get the max screen up. All right. Yeah. So those are the links I just sent you. I don't know why this is here, so let's get rid of that. Okay, so it looks like we did get the visual up, and the visual is just to kind of let you know what's going on, what I'm looking at. So we're not gonna worry about this one here. This one is going, so I'm not gonna worry about that. So yeah, no, I got the green screen thing going on, but I still don't know how to use it. Y'all know I don't know how to use it yet, but I'm working on trying to figure it out. But this ain't gonna be a long class. I just want to put you in the right place. So let me see if we can get the capture going. So we got the capture going, but I'm still having trouble with it. But I still wanted you guys to go back over the types of services, the E&M factors. So it was service, okay, place of service, type of service, on patient status. So, and that's just up there just so you can see where we were. So I'm just gonna kind of scroll down to some of the A&M services. Yeah, you guys can do that if you want to. Okay. So I did get that up from AAPC. Let me see if I can switch over to it. We were talking about showing you E&M audit sheet. I'm coming back at you. I wanted to show you guys where the E&M audit sheet is. Now they've changed it tremendously. I have like a beginner one in Sapphire Academy, so you can get into detail with it. But how you're going to get this, I'm going to put the link down. I don't know if this is the actual link or not, but let me see. This should be it right here. I'm gonna put this on the side. So this is an E&M worksheet, okay? And I got this from AAPC, so you guys can go ahead straight to AAPC and look at this. This is just to give you an idea of what an E&M audit sheet is. And how we were talking about, let me get in, because I don't know if you can really see that close enough, but I just wanted to put you in the right place with that. Um, Look, you see it says AAPC 2024. Go to AAPC And you can look at this yourself. As you guys know, that's where we're taking our test from. Our test comes from AAPC. And when you get ready to sign up and enroll in the AAPC, make sure you get some of the sample tests that they actually have in there. Okay, AAPC, that is your go-to. That is my go-to right there. Everything that you see me do in this classroom is evolved around AAPC. Okay, so I don't care if you new. I don't care if you've been coding for a long time. Go to AAPC. And I do prefer you to get your AAPC material when you get ready to take your test. I use the book material because that's the teaching material that they give us in Elsevier. So that's the one that I use. But when you're taking your test, I want you to get AAPC ICD-10, AAPC HCPCS. Okay. Your AMA, of course, has to be American Medical Association. So again, this is, I can't stress to you um, how important this is right now. Okay, because in order for you to get A&M, you have to know the ins and out of A&M. Yes, we're going through the step by step book, but this is more for you. Okay, this is more for you. As a matter of fact, this is could be homework for you tonight. I want you guys to go to aapc.com and pull this up. Okay, read the whole thing in its entirety. Because again, when you go to school and you have your online courses, I mean, we can't sit there for 10 hours and kind of explain it to you step by step. I'm hoping you guys can catch on with what we are allowed to give you. But when we give you more of what you need, this is where you're going to learn from. Okay, so when you are studying coding, or you're just starting out, or even if you're already in there and you just want to kind of brush up, I would go ahead and take heed to this, because this is how you're going to learn. I mean, in addition to what I'm giving to you. So this is in addition to what I'm giving to you. All right, so this is actually going to go into Sapphire Academy. It doesn't have to, because they all you need to do is go online. But I like to make sure that you guys can see what I want you to study. As you can see, they're going to tell you about the problem. Okay, a problem is a so and so. Problem addressed. A problem is addressed so and so. You see how it's giving you more explanation of what you even actually need. You see what I'm saying? So that's why I want you to make sure you go on there. And it's even giving you information on stable acute illnesses. Now, this is already in the step-by-step book. It's already in the CPT book. But this, to me, is a really, really good go-to guide. Okay? If you keep scrolling down, it even gives you drug management on here. But this is where I want you to be. Right there. Okay, this is the beginning of your task of medical decision making. So after you finish learning the coding portion of this is going to be your gusto right here. So this is the most current A&M and audit sheet, okay, that I've seen in AAPC. So you're going. This is how you do your coding. You remember we were talking about the different type of levels and what do you need. We were talking about low, moderate, and high. This is what we were talking about. Okay, this is public nature. We ain't copyrighting nothing. It's the same thing. Okay, but I want you to go to AAPC. So one, I want you to go there to get this aapc.com. All right. I want you to go to AAPC. Two, I want you to look at the test requirements. I want you to also look at what's going to be on the test. Okay, because the more I give you, the more you can incorporate. Okay, so again, this is a 2024 E&M audit sheet from AAPC. Are we gonna need this, Mr. Lambert? Absolutely. This is a part of your course. Okay, this is a part of your course. There are sheets in AAPC and there are sheets in Sapphire Academy that you can just download. This sheet right here is actually what I want you to go by, especially if you have never did office coding, never did medicine coding. This is one of your go-tos. Okay, like I said, follow that website aapc.com. That's who you're taking your test with. When you follow that, it's going to tell you what's on your test. Okay, what do you need to study for your test? You see that AAPC 2024 audit worksheet. The worksheet is how we determine what the provider is going to use. So if he gives us a code, we just need to make sure the code is right. He's doing the same thing. But as you can see down here, see it says review of prior external notes from each unique source. It says assessment requiring an independent historian. Okay? These are the notes that I want you to take. Make sure that you are clear on what we're looking at. When we get into deep coding with this is how you're going to need to understand the coding. See, it says time-based coding guidelines. We're in that now. We're in that now. So I don't know why this is not popping. We're in this now, so we're pretty much getting ready to study that now. I mean, that's what you're doing. You're studying this now. So I'm just going to head back to the step-by-step up. So we did medical decision making and then some. We're not going to go over any of that again. I want you to make sure you have your book and go over that time. As you're going over the order sheet, make sure that you're using it with your key components, because we did that already. Okay, so now I'm just kind of moving on to I'm moving on direct face to face, but I ain't want to skip over the order sheet because I said yesterday I was going to show you the order sheet. So that is the order sheet. I want you guys to go over that order sheet and go get that order sheet. Okay, I don't know if AAPC allows for you to download it or not, but that's the other portion that I want you to look at. Okay, so it's still here. I mean, if you have your book, you remember this is what we were going over. I think I got that fixed. I got that fixed now. So remember yesterday we were going over that. So the audit sheet is what I was telling you that I wanted you guys to get. It has to go with this. So you guys have to look at this. Okay, it has to go hand in hand because how are you going to know the basics of it? You know what I'm saying? That's why you need the books. The books that I gave you are the books that you need for your course. So like I said, as you're doing this, you need your CPT book by you. Okay. So let me just scroll down. Okay, so that's what we did. I gave you the order sheet that we were talking about that I was going to give you, and this still talks about established patients. Okay, and we already talked about some of the diagnosis and complexity of problems. Okay, this is just going to give you insight on how you're going to do the coding, what data you're going to do, what risks are going to be related to these diagnoses that you're giving the patient. You're not giving the patient, the provider is giving the patient. Okay, risk. Risks, if not treated, risk can be minimal, low, moderate, or high. Data to review to provide services. Data can be minimal, non-limited, moderate, or extensive. Diagnosis and complexity of problems for abrasion. Clean and dress. Options are minimal, limited, multiple, or extensive. Now, when you read that audit sheet, it's going to give you a breakdown of what that means. The minimal, right? The multiple, that's what I'm talking about. Okay, that's why you need to have all that stuff in front of you. Let me see if I hope I got this volume up. I know I ordered one of those things to take with me because y'all know I use my big mic, but I ordered one of those little tiny ones. People keep telling me to get it, so I did order one. So again, I just wanted to kind of touch bases on that. Example 2, diagnosis and complexity, same type of thing. Data review, high risk, and it's telling you what the definition is of what they are looking for. But it is also on that E&M and audit sheet. Okay, so the E&M and audit sheet is going to help you. That's what we were just looking at a few minutes ago. Okay, so let's just move down to, if I can finally get there. I know I've been saying I'm going to get there in a minute. We're getting there right now. Hold on. And I'm just going to read just a little bit right there. So there is a lot of information for you to review. A lot of information for you to review when you are choosing the right code for A&M. Okay, when you're choosing the right code for A&M, you got to use all the resources that they are giving you to use. You're going to learn that when you start the code, especially A&M. A&M on your CPC is probably going to be open and closed questions. Okay, whatever practice that you work at, they're going to have different types of levels, different type of patients, different type of severity of patients. Just make sure that you use the correct data to code those cases. Okay, the correct medical record information, the correct notes that the doctor has given you. Okay, and it gets easier. It gets easier every time you go through one code. The second code is going to get easier. Let me put this up. When you code one code, the next code is going to get easier. When you code another code, the next code is going to get easier. You're going to be talking about, oh, I can do this. Okay, so just, take your time and do the reading. Okay, and again, we just kind of putting you in the right place as far as what you need. Now, in the Sapphire Academy, there's a lot more in there, but you still can get a start from right here. Okay, so let's just touch a little bit of base on direct face to face and non-direct face non face to face. Okay, two descriptions of time. So direct face to face and non face to face are two descriptions of time. Direct face to face time is the time a physician spends directly with a patient during an office visit. If you have something like that on your test, and I'm pretty sure you will, know when the direct face to face time starts. If you forgot, you're going to read this tonight. Okay? This is where you're going to read that at. Okay? So direct face to face time starts when the physician has direct face to face. Not when the patient comes through and you start, registering the patient or whatever, whenever they get there. Okay, so we're not going to go over the whole thing. I want you to go ahead and do it, but I want you, this is where the direct face to face is. Okay, a physician spends time directly with the patient during the office visit, obtaining the history, remember history, performing examination, and discussing results. When you start reading that audit sheet that I gave you, you're going to get familiar with the HPI, the patient's history, examinations. That's when when you go to the doctor and the patient start asking you all your history and have you ever had this, have you have this in your family, have your parents have this. That's the kind of stuff they want to look for, kind of watch you for. So obtain additional history. See, just like what I said, family members and stuff like that. Okay, the total time can be used to report the A&M service for the AMA CPT guidelines. Now, we all know the guidelines take precedent, okay, over what you see in the book. Okay, so total time is the time spent face to face with the patient and time spent on performing other activities such as charting. Time A&M section is referred to in the statement such as this on the located codes of 99203. So the 99203s, you guys know, I told you the new codes. And in the new codes, you're going to spend much more time. That's where you're going to get the HPI from. So, right, because when you have a new patient, you have to drill this patient, to drill them, but you have to get as much information as you can. Then when the patient becomes an established patient, you don't need all of that, right? It's already there. Yep, yep. Time was not included in the CPT manual before 1990. Now, I ain't going to confuse you with that. Okay, that's not going to be on the test. Okay, so I'm not even going to tell you that. If you want to read that, you can read that. Okay. Okay, these statements concerning times are used when total time is spent with a patient. Okay, the times referred to these statements are the basis of the selection of the E&M code. Remember the basis of the selection of E&M code. Remember we did, you saw the 99211, 99212, 20 minutes, 30 minutes, 40 minutes. That's what they're talking about right here. So I'm on page 287 if you guys have your book open. Okay, so for example, an established patient for an office visit to get the results of a test. The physician spends about 20 minutes going over unfavorable results in the test. The physician discusses treatment. He also discusses prognosis, the risk of certain treatments. Because this puts you in the mind of when you go to the doctor, right? So the correct code would be 99213, in which the time established is 20 minutes of the total time spent with the patient. The physician must either document the beginning and ending time in the patient medical record or document the total time spent with the patient. So the total time or the documentation time. And there is a documentation code. I don't want to throw you off, but there is a code just for documentation, okay? A&M code example. Okay, so this is where they just kind of giving you an example of an A&M code. Now remember, we are doing evaluation and management coding, not surgical coding yet. Okay, so with the CPT manual open, you should have your CPT manual open to the first page of E&M section. If you don't, let me go to Mons real quick. What's that? Oh, I popped that up in there. All right, so if you don't have, like I said, if you don't have your book, oh, I skipped over my library. Hold on, buddy. Hold on, buddy. I know I got 2 or 3 different libraries. All right, so I'm just gonna pop in. I know I said I wasn't gonna use 2026, but I'm just gonna pop into my 2026 one. Um, Now I put the links over there. So if you don't have your book, remember you're going to need your book. Okay, you're going to need your book to do this. Okay, I don't know why they started from right there. Look, I need to show you this real quick. Can I get in here? Can I show them? It's on a different one. But you know how to do that. You should just wait. Hold on, I did this before. Hold on, let me see if I can get this in. So why does it do it here and it doesn't do it there? That's weird. Did it knock all my stuff out? It didn't, but let me see. Let me see. Now I can put it in. Oh, wait a minute. So out of it, let me do that. But I wanted y'all to see those first few pages of that book. I don't even know what it is. What happened to it? Oh, you. So why it ain't going here then? Okay, wait, hold on, y'all. I'm just trying to see something real quick. I was trying to see if I can pull it over so I can show y'all the other side, but it won't let me do it. It won't let me do that side. Let me see it again. I have to be in that. So I got half on Sapphire and the other half on Google. So that's why it's not letting me move over. All right, I have so much stuff up here at the top. I can't even fit nothing else up there. But I'm only pulling up my book to show you. Let me go here, and then I'm gonna pull up the 2025. I didn't give you out a CPT link for 2025. I don't see it. All right, let me go get it. I don't see it over there, y'all. So hold on. Let me see something. I don't know why that link is not there. All right, look here. I'll get it from here. No problem. Let me see if I can put it out here like this. So anyway, you're gonna have to have your CPT book. So I'm gonna put this right here, and I don't know why it's not letting me show y'all. Let me see. It might let me show y'all now. So let's see. Let me see if it. Let me see if it let me show y'all now. I know y'all know I'll be having a time with this thing. I'm trying to tell you. All right, so it's only letting you see the step-by-step book, but I just put that link there. I want y'all to go ahead and go into that link, especially if you don't have your CPT book. Okay, all you're gonna do is click on that link and you're gonna open. It's letting me open. It's just not letting you see it. I don't see it in here. I might have too much stuff open. That's why. Long as it lets you see it, I don't care. If you can't, as long as you when you click on that, guys, and you got that Kindle and it lets you in there that CPT book, use it. Okay, that's what you're gonna use. Okay, so again, your examples of your E&M codes are here. This is where I'm at. I'm on page 287, and in this book, let me put y'all on my radar. In this book, it's going to show you, because now it's starting to show you the basics. It's starting to show you the basics of how you're going to code. Okay, we talking about E&M, not surgical. You're talking about a whole different puppy when you're going into surgical. This is the purpose of this step-by-step book. it's now going to show you how to do the coding. How are you going to do the coding step by step? Here, let me see if I can get in there. Here is an example when they want you to code by time, which remember, A&M is coded by time, so you have to look at that chart. Okay, remember that audit chart. Remember this chart. Okay, remember this chart. Okay, you could also use this. Okay, there's one that gives you the time. See this right here? That's what I'm talking about. But it's already in your step by step, but you don't really need to get it from here. But I still want you to read this. Okay, I still want you to read this. All right, I will put this up here like that. I still want you to read that. Okay, so again, we kind of described to you direct face to face and non face to face. I don't want to skip over. I want to just kind of make sure we get through with that. And you do need to know, when does the direct face to face start? When does non face to face start? That's why I went over this. So make sure that you guys get this. I don't care if you're doing your homework or whichever one you wanted to be through. Just make sure you get through with that. Okay. When using total time on the date of the encounter of the code selection, 30 minutes must be met or exceeded. So it can't be 29 and a half minutes. Okay, it has to be 30 minutes. Okay, it has to be 30 minutes. Met or exceeded. Okay, met or exceeded. Total time may be used to report E&M services per AMA CPT guidelines. Read your guidelines in your CPT book. So even if you use the selective books, you still can get the guidelines from the front of it. Okay, so A&M coding examples, and here they are right here. Category by the patient status, place of service code, and time. Remember we were talking about the levels of coding, the 3 levels of coding. These are them. So you forgot, go back over that last chat or go to the beginning of this chat. Okay, with the CPT manual, open the first page of the E&M selection. Locate the notes above 99202 code. These notes highlight the incidents. So I don't know if everybody actually has their book, but when you get your book, this is what you're going to do. Okay, with me putting that link up there, everybody should have a book. Okay, so just pretty much follow what they're telling you to do right here. I just want you to pretty much make sure that you're clear on this illustration that you see right here. Okay. Okay, so locate the following: category, patient status, code, place of service. So generally, this section is just kind of getting you used to the place of service. How long did the doctor spend with the patient? Okay, what code am I going to use? It's so easy. If you see 99202, go to the minutes on the 99202, see how long the patient spent with the patient. Okay, so when using total time on the date of the encounter for the code, 15 minutes must be met or exceeded. It's literally telling you, and in your code book, it tells you that. So if you go to code 99202, it should tell you that right underneath that code. Okay. I would write this down, put it on index cards if you need to. Using E&M codes, I've learned about E&M codes. See, it says now you are going to use the information you have learned about E&M codes, E&M service section. You can continue to identify the service. So look, I don't want you to move on quicker than you need to. Hello. I don't want you to move on quicker than you need to, because if there's something that you're not understanding, then we must go back over it. Okay? We must go back over it. Okay, there are 2 things that I want you to make sure you do. Use your CPT book. Okay, use your CPT book. In the first portion of your CPT book, you must understand the E&M coding. Don't start the coding. You see in the CPT step-by-step guide, they're saying start the coding. Don't start the coding right now. Hi, Bishop. How are you? Sure, send it to me in attachment, no problem. You can send it to me. You can also send it to me through how do you call this thing? Send it to me to DM it if you can. If not, you all know my email. You all can send me attachments in my emails. This is the school email, y'all. Okay, so make sure you have your CPT guide. Absolutely, absolutely. Okay, and again, if you do have something that you want me to look at, that's fine. You guys can also attach it in here. We can get it out of here as well. Okay, so even though the step-by-step guide is telling you that they want you to start coding, I don't want you to start coding yet. Before you start doing the coding, I want you to look at the order sheet. Look at the order sheet first. I mean, I know they just want you to jump right in it, but that's not how I roll. We need to go over more for you to make sure that you're clear on what you're doing. Okay, so I want you to go back over office or other outpatient. Okay, um, if you have your CPC guide, I also want you to read the evaluation and management section. Okay, I don't care if you read it again. Read it again. I said read it again. Okay, right now I'm on page 288. Okay, I'm trying to backtrack. I'm trying to stay on code example. I don't want to get to documentation too quickly. All right, so I'm at E&M code example, and then using E&M codes. Documentation is going to be next. So I'm not going to documentation guidelines today. Okay, we're going to do this portion today. Okay, so new patient. Remember we were talking about the new patient. They didn't give us much on direct and non-direct face-to-face. I gotta find some more on y'all on that, which is already in here. That's why I want you to also get your CPC guide as well. Okay, but I just need to make sure that you guys did get that understanding of direct face-to-face and non-face-to-face time are two descriptions of time. Now, when you get your CPT book, in your CPT book, there is codes in there for non face to face, and there's a lot of description in there, which we are going to go over. Okay, so direct face to face time is the time a physician spends directly with a patient during an office visit, obtaining a history, performing also the examination as well. Remember, we talked about that. They talk about results. Okay, they talk about results. Okay, and a non face to face time describes the time a physician spends reviewing results and obtaining additional history. Because remember, I said there's codes for that too. Even if a provider has to sign something, you guys know that you need to code that because it needs to be in a record. So pay attention. Non face to face. You are not looking at the patient. You're not looking at the doctor. Describes the time a physician spends checking results, getting history from other family members. He might be writing medications. He might be reviewing tests, or he might be doing some type of other, physical therapy or something like that, or something with the patient. Okay, without the patient being there. Okay, checking out what the patient can use to better his therapy, or subscribing stuff or looking at things. That's non face to face time. Okay, so do not forget that. There's two different things, and they can be coded. Okay, can be coded. Okay, and that's the various levels. Okay, various, as in many levels of coding that we talked about. Okay, we already did the code examples. I'm just kind of backtracking because it was so quick in this section. That's the reason why I want to make sure that you also look at your E&M, your CPC guide. When you start looking at your CPC guide, I want you to stop at hospital observation. Stop at hospital observation. Okay, because we just did E&M code example with the CPT manual open. They're just telling you, I still want you to look at the 29202 and then some. Look at that, and then you're going to read this. Okay, the information also directs you to other subsections. Every code is going to direct you to something else if it's not giving you the right information. Okay, so let me take that off. Okay. Yeah, no. So still at the beginning. Still at the beginning. So I still want you to do. So I know you have your book, right? I'm sorry, I have a different screen here. All right, so yeah, you have your CPT book. I want you to do introduction to objectives again because we did that already. Really, it's almost like the same thing. So in your CPC guide, you're going to see introduction to objectives. Same thing almost that we were looking at specific objectives, define E&M services, summarize E&M guidelines. It's just that's the same thing. Pretty much what we're doing here. Then I want you to do E&M service defined. Okay, I still want you, even though we did it 99202, you got your CPT, I still want you to look at those things. Okay, and I want you to do CPT E&M services guidelines, new versus established patient. We just kind of went over that. E&M service category, office or other outpatient services. Stop. That's all you're gonna read in the CPT book. So some of you guys who got your CPC guide, that's what I want you to read. Okay. Office or other outpatient. That's where I want you to stop at. Okay. So we had this on what's the name? How come it's not showing up? I don't know why it's not showing up. Today, I'm going to work with this thing today because we sit here back here with this green screen. They told me to get this green screen so this thing won't be clipping and pipping how it's doing right now. And I don't know. I got to find out what's wrong. So I definitely got to call Jay Quan to see what's up with this. Okay. Okay. So we're already 39 minutes in, but I still wanted to make sure that you guys got everything that you needed. Bishop, make sure you show me your thing. I'll review your portfolio. You can show it to me. Make sure there's no errors in it. Okay. Make sure there's no errors in it. So you guys make sure if you guys are doing your resumes or XYZ, make sure that you use Grammarly.com to correct any of your errors that are on there. They have a free version also on Grammarly. All right, so go over that. All right, and again, don't forget the discussion board. I mean, DB is discussion board. DB is discussion board. Okay, discussion board is DM. Same thing. If you can attach that portfolio, then you can go ahead and attach it to me, or you can send it to me in the email. That's fine. You can use the school email right there. That's fine. And we can take a look at it. So, you guys got any questions for me so far? You guys got any questions for me? So, I'm in a step-by-step book. I'm just kind of looking at the categories here. So, let me just see if I can get. I'm trying to look at something right now. So everybody should have the CPT book. I just gave it to you because we're only in the beginning. Okay, we're only in the beginning. Okay, when you open your CPT book, I want you to look at those symbols. Okay, you remember we went through the ICD-10 in the beginning? I want you to look at the CPT code symbols. Okay, so look at those. Okay, we did the modifiers. I want you to look at those. Okay. We went over the level 2 modifiers. I still want you to look at those. Place of service codes. Remember, we went over those. I want you to look at those. Okay. And I gotta figure out how to get into this one. I'm not sure why I'm always having trouble getting in here. Amazon. I'm not gonna spend 15 minutes on doing it, but I'm gonna fix it in here so next time we can go ahead and do it. Okay, so place of service codes. I want you to. This is homework for you tonight. There's no class tomorrow. I'm not having class tomorrow. There'll be no class on Sunday. You guys know your days are really Monday, Friday, and Saturday. So class is normally 3 days a week. Okay, but again, I want you to look at those place of service codes. The next class is gonna be on Monday morning. Okay. CPT, CPT, CPT. Forget about the disclaimer stuff. About CPT. I also want you to look at about CPT and maintenance. just want to see if, because nobody can say they don't have CPT book at this point, because at this point in the class, I'm only at the beginning. I've already given you the link to the free book. Okay, I've already given you the link to the free book. Right here, you guys can't see it, but we're talking about time. Okay, you can hit the anesthesia guidelines, that's fine, and whatever else is in the front. I will not do anesthesia next. I'm going to do medicine next. So even though it's in the book like that, that's not how I'm going to do it. Okay. Release of CPT codes. Make sure you hit that. Release of CPT codes. CPT codes set updated calendar. Important. Okay. Category 1, release timeline was August 31st. Effective timeline was January 1st. Okay. Category 2, 31st, January 1st. Category 3, January 1st. Release time, July 1st. Okay. Just remember that. Okay. So you're going to go over that anyway, because I don't want you to make a move until you read the first portion of this CPT book, instructions for use of the CPT book. Make sure you read that as well. Okay, I'm just glad that we already went over all of that. Check out some of the other classes. You guys know we already went over that. And we're only going over this portion right here because we're up to this, and I just need to go over this with you guys. Once we start going over all the surgical sections in there, that's when you start kicking in. When you, those of you who are in the Sapphire Academy, if you got your surgical, if you're up to surgical sections, make sure you combine them with your classes in Sapphire Academy. Okay, make sure you do combine them. So if you're in the Sapphire Academy and you're on cardiology, you should be looking at the cardiology portion when we get up to that. Okay. I don't know what that is. Okay, category 3. I want you to read all that category 3. So in the front of your book is basically guidelines. It's basically your guidelines. You're going to read them step by step. Place of service, facility reporting. Okay, unlisted procedures. Okay, you don't have to move forward all the way there. I'm just kind of telling you what else is in here. The only thing I want you to read up in here is your guidelines in the beginning and right here. Okay, I'm saying right here. You can't see it, but resulting, testing, results, testing, interpretation, report, special report, time. That's where I want you to start. The CPT code set contains many codes with time basis for code selection. Okay, that's where I want you to start at. Okay, that's where I want you to start at. Okay, don't do the prefixes and the roots. We've already done that in medical terminology. You do not need to do that. But if you want to write them down, you can, which you should have already. Phlasia, paresis, osis, urea, those you can write that down if you want to. That's not what I'm looking for though. But we already did that in the classroom. Because everybody should have the same manual that I'm looking at. I'm just getting to the front part. Okay, the planes and illustrations, yes, you can look at. Okay, evaluation and management tables. That's where you're going to start at. Okay, evaluation management tables. Next segment Monday, I'll figure out how to let you guys see this. But it's already in the CPT manual. I don't really need to show y'all anything. So the CPT link that I just gave you guys, that is absolutely free. That's what you should be looking at. And then here, consultation services, new established patient subject hospital. Don't go all the way down there, but you could just look at the rest of that. I want you to go where it says new or established patient, initial hospital patient, inpatient, and observation. I want you to go ahead and start from there. Let me see what else. Okay, no, don't go all the way. Don't do critical care. Don't do subsequent nursing. We have not gotten up to that yet. Okay, so don't do any of that. Right here, evaluation and management guidelines. Okay, that's where I want you to start at. Okay, so I'm giving you different sections of reading your CPT guide, but the main thing is to stay on new and established patients. Okay, initial and subsequent services. You can read that one. I'm just trying to see how far can you go in here. Okay, that's mainly guidelines. I need to see codes, but I need to see codes. Okay, guidelines. All your guidelines is in here. what I'm doing is looking at the CPT book. I'm looking at the CPT book to see how far you can go with this free book. So it is giving you the full E&M service. Okay, good. So I'm right here at 99214. So it looks like, yeah, it's gonna give you that full service. You guys can't see it, but you when you click on it, you can see what I'm talking about. You can see what I'm talking about. Okay. So let me see something. What email do we use? Uh, Let me see if I can get in here like this, y'all. Oh, I mean, it's ridiculous. I can't get on. I'm gonna come up out of this one real quick so I can go in here. Let me see if it let us. Hmm. 2 steps. All right, so it doesn't give me that. I have to do it when I sign off. Um, Let me see if I can go into here and let me see if I can go in here, y'all. Cause see, I can do it from the Safari, but it's for some strange reason it's. All right, so those free links that I gave you on the those free links that I gave you on the bottom, make sure you use them. All right, because until I get this where you could actually see, I'm not gonna spend 15 minutes on messing with that. But I want to get this to the point where you can see what I'm trying to show you on that book right there. I can flip back and forth on StreamYard. I guess I can't flip back and forth on the OBS, so I'll have to get them all on the same page for you, especially when I'm using this one. So um, we're 51 minutes in, but like I said, we're in. All right, get out of here if you ain't gonna open. We're in valuation and management. You're to be reading the guidelines of your CPT, okay, and you are not to go further than other outpatient office or other outpatient, inpatient, outpatient, okay. I don't want you to go too far. Established patient, yes, I want you to go there. Because we talked about that, right? The second category of code in subsection office and other outpatient services is for established patient. An established patient, okay, outpatient setting. Established patient is 99211 through 99215. Remember, we talked about that. A new patient is 02, 01, 03. That's a new patient, okay? The established patient is the 1-5. Okay, you recall that definition of an established patient is one who has received professional services or physician services of the exact same specialty and subspecialty in the same group within 3 years. So it's just vice versa. Remember the new patient. If you haven't been there in 3 years, if you haven't seen anybody in a group in 3 years, you're a new patient. If you have within 3 years, then you are still considered an established patient. Okay, so tonight we are going to do the AAPC audit worksheet, and I want you to go on AAPC and look at their website. Okay, I want you to look at their website. Get this audit sheet. Read everything in this audit sheet. Okay, read everything in this audit sheet. Okay, make sure you have the CPT. Everybody should have the CPT because I just gave you the link for it. Okay. I'm gonna do a chat on those books. I don't care who anybody can use them. Okay. Um, we didn't get down to the telemedicine, but we are going to talk about the telemedicine too. Uh, if you want to, oh, I thought I had up. If you want to kind of mess around with these, you can. You can go ahead and try to do those. It should be okay for you to mess around with those. But again, you gotta have your CPT book. Okay, you have to have your CPT book. Okay, so let me just get back in here. I know I don't have to stick back, but it don't matter. We could just leave it. I mean, the class is over. I mean, I'm not gonna try to fix nothing. The class is already over. Okay, so if you want to try these, you can. You know, you can try those. I mean, I don't think they're that bad. But again, you're gonna need your CPT book. I know a lot of you at work now. I know a couple of y'all that work on Saturday. So when you get ready to archive this, you are gonna need your book. Get the link. Look at the side and get the link, or look down below and get the link. Go to our website, sapphirecoding.com. If you want to join sapphirecoding.com, go ahead and let me know. Um, that class is $99. You get access to everything in the classroom. Uh, if you want the medical coding Q&A book, that book actually comes with the class. So when I send you like your group video or something like that, they're already in there, so you don't have to pay for that. That book comes with the class. So if you join the Sapphire Academy, the medical coding and Q&A book comes with the class. That means you're all ready to start. So that's why that book already comes. But if you want to buy the book separate, you can go on my website and get the book, or you can get the book from Amazon if you want to. So my book is also on Amazon. Okay. Okay, so remember, it takes a lot of practice to learn how to code. Uh, it takes a lot of skill to learn how to code. Okay, um, you definitely need to have patience because it's like I said, it's going to be practice and practice and practice. You're going to have to self pace yourself, and I don't know how difficult it is to either learn physical or learn online. What I see is, I don't know what that is. What I see is just the paying attention, online. Sometimes a lot of stuff is distracting you and you have to get up and you have to move. But the good thing about it online is you can pause and keep it moving. You can pause and keep it moving. And you're in your own setting. And a physical class, I mean, you do get to ask the teacher whatever you want in the classroom. And she can literally show you, but she can also do that here online as well. Okay, y'all? So do not forget that. It always seems like a big difference between online and not online, but you guys can get the same type of skills. Okay, so what we do here is what you are going to study. Okay, so observation and discharge. No, I'm trying to make sure I don't want to put hospital in with that. So telemedicine. Let's do telemedicine. Okay, this is telemedicine right here. And I gave y'all also a link for this book as well. Okay, telemedicine is going to be quick, and yeah, you're going to go over telemedicine right here as well. Okay, so the code in the telemedicine section are the codes that we're going to use for that section is 98000 through 98016. Those are the codes. Okay, those are the codes that we're going to use in the telemedicine. Now, as you can see in the telemedicine, you see how it starts with 9 and not 99? Those are medicine codes. They're medicine codes, okay? So the codes in the telemedicine section start with 98000 through 9801. Y'all can go to that section right now if you got your book. If you got your book, go ahead and go to that section. Okay? Are assigned to report real-time encounters where the patient and physician or other qualified health professional are interacting live through a I can't even say it, synchronous medium, okay, such as audio, audio only, telecommunication, stuff like that. So you guys know what I'm saying when I say telecommunication. Um, the encounter must be agreed upon for both sides. Okay, we know. Because a lot of times, you want to call your provider. They say they want to send me an email, or we can communicate like that. Like how they have a lot of stuff where they have your medical record online. You just kind of type in and see if you want to message the provider or something like that. And then she can set up a one-on-one encounter with you, which is a teleservice. Okay, so that's what we mean when we say teleservices. Services are reported for both new and established patients based on the medical decision making, okay, and or the total time spent on the day of the encounter. Okay, the services do not include reporting or routine follow-up communications, reporting additional telemedicine services, follow-up, or encounter just as it would require for an inpatient scenario. Okay, combined audio video services are reported. Combined, that means they're going to do several different ways, audio, visual, and so it'll be more than one code, obviously. 98000, 98007. Go to that code and take a look at it while I'm just kind of reviewing this. Okay, so you are going to read this. The prolonged services, oh my God, very, very important. Okay, the prolonged service code is 99417. This is where you also going to need that calculator at. Okay, because that was a doozy for some of my students, the prolonged services, because it's a certain point where you got to round it off. Okay, we ain't get to that yet, but we're going to get to that. Okay, prolonged services 99417 is reported when time exceeds the allotted time indicated. Instances where our established patient initiates a shorter telemedicine encounter. Now, when this happens, you have to have a calculator until you just get savvy with it so you can know how to round the thing off. Okay, with a physician or qualified health professional. Okay, to determine whether the patient needs more evaluation services or it qualifies for just a virtual check. Okay, look at this code 98016 for the first virtual check-in. Um, like when you go in there, you want to check in before you get here. They have to code all this stuff. Um, if additional EDM services are conducted, same day services. Okay, we don't have to read that all of that, but I just want to make sure that you are in, you guys are in the right place. For remote EDM services with a provider and a patient, do not interact in real time, non-face to face. Non-face. Look, I want you to look at every one of these codes tonight. Okay, every one of these codes tonight, you should look at them and look at the codes. 99999999. E&M section. Okay, E&M section. You can go to the medicine section and take a look. Since you're already in the CPT section of evaluation and management, I want you to go to medicine and just take a look at those codes. You see those codes only have 9 in front of them. Okay, I'm not sure why this one is pausing. That one's always a problem. Okay, so stop hospital observation. We are not going past hospital observation. Okay, let me see what else is going to be in here. Telemedicine, hospital observation. Okay, so that's all in using E&M codes. Oh yeah, so when we come back, we're going to see. Did it start at telemedicine? Yeah, it started at telemedicine using EM codes. Okay, so office and outpatient. So I don't know why they gave you tests for office and outpatient already. Established patient. Okay, so at any rate, if you have your step-by-step book, I want you to stop where it says hospital observation. We're in using the E&M codes. Okay, if you have your CPC book, I want you to read the beginning portion. Okay, just read that portion. Like I said, read that up to office or other outpatient services. Okay, don't go past that, because if you go past that, just straight cramming. Don't do that. I want you to take something, especially since you guys already have off tomorrow. I'm not gonna do class tomorrow. I'm gonna do class Monday. So I'll see you guys on Monday. So look how fast I'm already. Okay. So this class is over. Get those links on the bottom. Make sure you get them. Richard Paul, send me your portfolio if you'd like me to take a look at it. Okay. And if you guys want to go on that website and get that book, want to go on the website and join the courses, here it is. I'm putting a link down here. If you want to just go on and look at my bookstore, go ahead and look at the bookstore. Um, I've written 3 books on medical billing and coding. Go ahead and take a look at it. Now, I don't know if Facebook hit or not, but we did put y'all in on Facebook. Okay, I can't get the Sapphire